Multiple choice questions, MCQs, focused on deaf blindness and additional conditions, including specific reference to congenital rubella syndrome, CRS, Usher syndrome, Charge syndrome, and chromosomal abnormalities. 1. Deaf blindness refers to a condition involving A. Only visual impairment, B. Only hearing impairment, C. A combination of visual and hearing impairments, D. Cognitive disability. Answer, C. A combination of visual and hearing impairments. 2. Congenital rubella syndrome, CRS, is caused by A. Bacterial infection, B. Genetic mutation, C. Maternal infection with rubella virus during pregnancy, D. Vitamin deficiency. Answer, C. Maternal infection with rubella virus during pregnancy. 3. Usher syndrome primarily affects which two senses? A. Touch and taste, B. Sight and hearing, C. Sight and smell, D. Touch and balance. Answer, B. Sight and hearing. 4. Charge syndrome is A. Single sensory disorder, B. Congenital condition involving multiple anomalies, C. Temporary illness in children, D. Psychiatric disorder. Answer, B. Congenital condition involving multiple anomalies. 5. The acronym CHARGE stands for A. Cardiac hearing ataxia retinitis genital eye, B. Coloboma heart defect atresia Chwane retardation genital ear, C. Cataract hypotonia ataxia retinitis growth eye, D. Congenital heart autism retinal genetic eye. Answer, B. Coloboma heart defect atresia Chwane retardation genital ear. 6. Chromosomal abnormalities like trisomy 13, Patau syndrome often involve A. Only mental retardation, B. Only physical disability, C. Multiple organ system anomalies including deaf blindness, D. Only hearing loss. Answer, C. Multiple organ system anomalies including deaf blindness. 7. A child with Usher syndrome may first be diagnosed with A. Visual impairment only, B. Hearing loss at birth and progressive vision loss later, C. Speech delay only, D. Autism. Answer, B. Hearing loss at birth and progressive vision loss later. 8. Deaf blindness may be categorized as A. Congenital or acquired, B. Physical or mental, C. Neurological or psychological, D. Regressive or non-regressive. Answer, A. Congenital or acquired. 9. Rubella infection, during which trimester is most dangerous for the fetus? A. First trimester, B. Second trimester, C. Third trimester, D. Postnatal period. Answer, A. First trimester. 10. Charge syndrome may include all of the following except T. A. Coloboma, B. Hearing loss, C. Down syndrome, D. Cranial nerve anomalies. Answer, C. Down syndrome. 11. A child with both visual and hearing impairment may also require support for A. Academic skills only, B. Motor coordination only, C. Communication, mobility, and cognitive development, D. Language translation only. Answer, C. Communication, mobility, and cognitive development. 12. Charge syndrome is most often caused by mutation in which gene? A. CHD7, B. GJB2C, PAX6D, FMR1. Answer, A. CHD7. 13. Usher syndrome is inherited in which pattern? A. Autosomal dominant, B. Autosomal recessive, C. X-linked recessive, D. Mitochondrial. Answer, B. Autosomal recessive. 14. Children with deaf blindness often face difficulties in A. Social interaction and communication, B. Physical growth only, C. Attention span only, D. Memory skills only. Answer, A. Social interaction and communication. 15. Which of the following is a common chromosomal condition associated with multiple disabilities? A. Turner syndrome, B. Down syndrome, C. Achondroplasia, D. Klinefelter syndrome. Answer, B. Down syndrome. 16. The hallmark feature of Usher syndrome type 1 is A. Normal hearing and progressive vision loss, B. Profound hearing loss and balance issues, C. Delayed speech, D. Isolated vision loss. Answer, B. Profound hearing loss and balance issues. 17. Charge syndrome may include which type of eye defect? A. Retinopathy, B. Coloboma. C. Myopia. D. Glaucoma. Answer: B. Coloboma. 18. Which of the following is not a feature of congenital rubella syndrome? A. Cataract. B. Heart defects. C. Hearing impairment. D. Cystic fibrosis. Answer: D. Cystic fibrosis. 19. Deaf blindness requires: A. Medical management only. B. Multisensory and individualized educational strategies. C. Strict discipline. D. Institutionalization. Answer: B. Multisensory and individualized educational strategies. 20. Coloboma affects: A. The cornea. B. The eyelid. C. The iris, retina, choroid or optic disc. D. The pupil only. Answer: C. The iris, retina, choroid or optic disc. 21. Charge syndrome includes genital hypoplasia, which refers to: A. Undeveloped external genitalia. B. Enlarged genitalia. C. Normal growth of reproductive organs. D. Absence of hormones. Answer: A. Undeveloped external genitalia. 22. Interveners play a key role in: A. Rehabilitation of deafblind individuals. B. Conducting genetic testing. C. Treating infections. D. Providing medical surgery. Answer: A. Rehabilitation of deafblind individuals. 23. Rubella is preventable through: A. Antibiotics. B. MMR vaccination. C. Herbal medicine. D. Isolation only. Answer: B. MMR vaccination. 24. The most critical period for sensory development in a fetus is: A. First 3 months of pregnancy. B. After birth. C. 6th month. D. 3rd trimester. Answer: A. First 3 months of pregnancy. 25. Tactile signing and object symbols are communication methods used with: A. Children with ADHD. B. Children with autism. C. Children with deafblindness. D. Children with SLD. Answer: C. Children with deafblindness. 26. Individuals with deafblindness often need: A. Auditory therapy alone. B. Visual therapy alone. C. Multisensory input and mobility training. D. Only medication. Answer: C. Multisensory input and mobility training. 27. In chromosomal abnormalities, trisomy 21 is also known as: A. Patau syndrome. B. Turner syndrome. C. Down syndrome. D. Klinefelter syndrome. Answer: C. Down syndrome. 28. The most severe impact of CHARGE syndrome on learning comes from: A. Vision problems. B. Hearing loss. C. Combination of multiple sensory and physical impairments. D. Heart condition. Answer: C. Combination of multiple sensory and physical impairments. 29. Early intervention in deafblind children helps in: A. Reducing physical deformities. B. Enhancing communication, cognitive and social skills. C. Complete cure. D. Delaying developmental milestones. Answer: B. Enhancing communication, cognitive and social skills. 30. Which syndrome is characterized by sensorineural hearing loss and progressive vision loss? Retinitis pigmentosa. A. CHARGE syndrome. B. Down syndrome. C. Usher syndrome. D. CRS. Answer: C. Usher syndrome. 31. Which system is primarily affected by congenital heart defects in CRS? A. Respiratory system. B. Digestive system. C. Cardiovascular system. D. Nervous system. Answer: C. Cardiovascular system. 32. Which of the following is a key feature of trisomy 13, Patau syndrome? A. Microcephaly and cleft lip/palate. B. Asthma. C. Tall stature. D. Hyperactivity. Answer: A. Microcephaly and cleft lip/palate. 33. Which communication method uses touch-based hand signs for deaf-blind individuals? A. Braille. B. Total communication. C. Tactile sign language. D. Lip reading. Answer: C. Tactile sign language. 34. Children with deaf-blindness often benefit from assistive technologies such as: A. Hearing aids only. B. Smart boards. C. Tactile devices and Braille note takers. D. colorful flashcards. Answer: C. Tactile devices and braille note takers. 35. A genetic counselor's role in syndromes like Usher or Charge includes: A. Providing medication. B. Conducting surgeries. C. Supporting families with diagnosis and inheritance risk. D. Teaching academic skills. Answer: C. Supporting families with diagnosis and inheritance risk. 36. One of the earliest signs of retinitis pigmentosa in Usher syndrome is: A. Tunnel vision. B. Color blindness. C. Blurred vision. D. Eye redness. Answer: A. Tunnel vision. 37. An intervener supports a deaf-blind child by: A. Managing medications. B. Acting as a communication and access facilitator. C. Taking over the role of a parent. D. Making medical diagnosis. Answer: B. Acting as a communication and access facilitator. 38. Children with Charge syndrome may experience difficulties in: A. Swallowing and breathing. B. Intelligence only. C. Playing with peers only. D. Excessive weight gain. Answer: A. Swallowing and breathing. 39. In educational settings, the term multi-sensory approach refers to: A. Teaching only through hearing. B. Use of sight only. C. Engaging more than one sense for learning. D. Learning through physical punishment. Answer: C. Engaging more than one sense for learning. 40. The severity of Charge syndrome varies because: A. It depends on nutrition. B. It depends on which systems are affected and the mutation's impact. C. It spreads through viral infection. D. It can be cured in infancy. Answer: B. It depends on which systems are affected and the mutation's impact. 41. Rubella infection is most dangerous to the fetus during which period of gestation? A. After 28 weeks. B. 20 to 30 weeks. C. Before 12 weeks. D. Just before delivery. Answer: C. Before 12 weeks. 42. One major difference between Usher syndrome and Charge syndrome is: A. Charge is genetic, Usher is not. B. Usher affects cognitive ability, Charge does not. C. Usher is mainly a dual sensory loss, Charge is multisystemic. D. Usher is curable, Charge is not. Answer: C. Usher is mainly a dual sensory loss, Charge is multisystemic. 43. Which chromosomal condition is associated with 3 copies of chromosome 18? A. Trisomy 2-1. B. Trisomy 1-3. C. Trisomy 1-8. D. Turner syndrome. Answer: C. Trisomy 1-8. 44. A common feature of Down syndrome includes: A. Severe vision loss only. B. Mild hearing loss and cognitive delay. C. Blindness. D. Chronic diarrhea. Answer: B. Mild hearing loss and cognitive delay. 45. The sense of balance is often affected in which type of Usher syndrome? A. Type 2. B. Type 3. C. Type 1. D. All types equally. Answer: C. Type 1. 46. In Charge syndrome, atresia of Choanai refers to: A. Blockage of nasal passages. B. Blindness. C. Deafness. D. Absent limbs. Answer: A. Blockage of nasal passages. 47. Early diagnosis of deaf-blindness is important for: A. Enrolling in mainstream school. B. Planning early intervention and communication development. C. Providing medicines early. D. Avoiding surgeries. Answer: B. Planning early intervention and communication development. 48. Which of the following is not a chromosomal condition? A. Down syndrome. B. Patau syndrome. C. Charge syndrome. D. Edward syndrome. Answer: Sarka-Charge syndrome. 49. A child with dual sensory loss may benefit most from: A.